brief remarks. I'll now turn it over to Dr. Alex Garza.
Okay, good afternoon. I hope everybody had a pleasant weekend. So as many of you are aware, we saw a big spike in our hospital admissions on Saturday, climbing to over 50 for the first time since May 2nd. I don't want to ignore that milestone because it's important to acknowledge what that number represents, which is the virus continues to spread throughout our community. However, as we've said before, we don't react to those daily fluctuations in the data. It is a one-day total, and as we've said before, we pay attention to the trends and not necessarily to those daily differences. And just to demonstrate that point, on both Sunday and Monday, we found a considerable drop in our cases back into the 30s. Now, this is welcome news, and we're hopeful that this will continue as a trend and that the numbers will continue to come down. But we also know that without continued efforts to keep transmission suppressed, we can go in that other direction just as quickly. So it's Monday, and we'll be taking a closer look at some of our modeling data and our scorecard data like we did the previous couple of weeks to give you a better idea on where we're trending. And then we'll take some questions from the media. So as always, we start with our hospital admissions data. But first, I wanted to make a correction on our admissions data from yesterday when we reported 32 admissions, when it was actually 36. When we went and looked back at our data today, we noticed that one of our hospitals had not reported their admissions data. So we apologize for this confusion. However, it's still a marked decrease from our admissions on Saturday, and so it's still good news. Today, we saw 33 admissions, which is down considerably from where we were just last week. Now, with the correction of the admissions yesterday, we're still at a rolling 7-day average of 42. So we're still at that high rolling 7-day average, but at least for the last couple of days, we are improving. So now we're going to move on to our hospitalization data. And again, this represents our daily hospitalized census in our task force hospitals. And these are confirmed COVID positive patients only. Now this number jumped considerably today, which is really no surprise given that high number of admissions that we saw over the weekend. And so today we have 290 hospitalizations, which is up from 242 yesterday. Today our 7-day moving average sits at 252, which is a 6-point jump from yesterday as well. Now let me update you on some of our daily hospitalization numbers, and again, these are our COVID positive patients only. As I mentioned, we have 290 hospitalizations today of confirmed COVID patients. We have 72 COVID patients in our intensive care units, and we have 30 confirmed COVID patients on ventilators. Now moving on to our suspected COVID patients. So again, these are patients that we believe may have the virus, or we're waiting for test results to come back. So we have 179 hospitalizations today of suspected COVID patients, and that's a rather large jump from last Friday when we had 106. So we've added 70 more suspected patients since then. Now we have 19 suspected COVID patients in our intensive care units, and we have 12 suspected COVID patients on ventilators. And this is our good news slide again. We have discharged 20 additional COVID patients from task force hospitals, bringing our cumulative total to 3,982 patients. And again, it's great to see this many people recovering and being released back home, but it also means that we have increased numbers in our hospitals, and so we're going to continue to see those high numbers of discharges for quite some time. And again, thank you to all of the healthcare providers and the people that support them for getting these patients better and able to go back home to their loved ones. So as I mentioned, now we'll walk through some of our modeling data and show you where we are with the pandemic. Now you've recognized this from last week, so the models again were updated for the data for this past week. And one thing I did want to share with you on these data, so if you look at the graph on the right hand side, that was last week's model. And again, I believe I mentioned last week that we would be approaching a peak around August 20th if things continued the way that they did, with no slowdown in cases. Now, the model on the left-hand side is our updated model, and it takes into account what we believe is transmission occurring in the community and how it impacts our inpatient census. And so one thing that you will notice is that the curve is starting to turn a little. It's becoming much more flat than it was last week, which is a good thing. So now we're projecting that if we reach that second peak, matching where we were back in the springtime, that wouldn't occur until September. And again, this is with an understanding that nothing is going to change. So if we continue with the pace that we're on right now and don't bring cases down, we would see that peak in cases around September timeframe. Now hopefully we can continue to flatten this curve with a decrease in transmission, but this is where we are right now. And again, these are just some blown up pictures of the models that I just showed you. And so again, you can see that our curve for our inpatient census is now starting to flatten a little bit, which is a good thing. This is our intensive care unit census. And again, the model showing that it is starting to flatten as well. And so you've heard me talk about our intensive care unit status and how it's being affected by a younger patient population and the not as vulnerable people being admitted into the hospital. And so our intensive care unit status has slowed down, which is good news as well. Next is our rolling 7-day average, and this is a number that we follow every day, and so this shouldn't be new to anybody. And again, it seems there at the top, now again, this is just over the last couple of days where it's sort of plateaued, and we're hoping that this is going to continue either to plateau or come down, hopefully come down. But again, that significant rise over the past 2 to 3 weeks was really concerning. And this is our epi curve, so this is the number of cases. Before I was showing hospitalization data, but this is cases that have occurred over the St. Louis metropolitan area. And I think as everybody is familiar with, we saw that rapid rise in cases over the last 3 weeks. But as has been reported in the media, we have seen a decrease, not just here in the metropolitan area, but across the state. And so hopefully this is the beginning of a trend to come down with our case counts. And again, this shows our case counts at all of our county levels throughout the statistical area. And all of them look fairly similar to where they were last week, with the case counts continuing to go up. With an exception of some of the smaller counties. Again, we're hopeful that we can begin to turn this curve. We're still at a very high level of cases out in the community. And so we need to continue to do those things to bring those case counts down. Our next slide is where we've seen the significant change in cases week by week. And so again, this is comparing last week to the week before, and then it's the absolute difference in cases, and that tells us where we've seen large increases in the number of cases. And just as last week, I'll share with you some of the regions where we've seen some of the largest increase. And so you'll see we've highlighted 2 areas here. One is Chesterfield, which is the 63017 zip code, which saw 132 new cases last week. The other one is Florissant, which is the 63031, which saw 159 new cases last week. Now, there's a couple of other zip codes that we wanted to bring to everybody's attention. One is in the Florissant and Blackjack area, which is 63033, where we saw 110 cases last week. And then finally, the St. Peters and O'Fallon region added 110 cases last week as well. And we know that this map is difficult to read, especially on our briefing here today, but it'll be posted on our website. And so if you wanted to look at your zip code, you can take a look at that as well. And again, you'll see how those different zip codes will fluctuate from week to week depending upon where cases are spreading. And what that really means is it's spreading throughout the community. It's not isolated to any one zip code or any one area. It just depends on what week it is. Next is our reproductive factor, which, as most of you know, we want our reproductive factor to be below 1. If it's below 1, then we've interrupted transmission. Most of our counties here are above 1, including that confidence interval. And so we know that transmission continues to spread in our community throughout most of our large population centers. So this is our modeling slide. So now we're going to move on to our scorecard. So we introduced this last week, and we're going to continue to show that to you going forward on Mondays. So this is, again, our bed occupancy. So this shows the strain that's being put on the healthcare system, and this is our COVID positive and our patients under investigation, or the patients that were waiting for test results to come back. And this shows our total hospital capacity as well as our intensive care unit capacity. And we'd like for both of those to be below 10% before we start getting into that concerning area. And both of them remain below that 10% area. And so as you can see, it's around 8% for our ICUs and around 6% for our total bed capacity. So we're still in the green there, but we're continuing to get close to the yellow area. And we'd like to see that continue to either plateau or come down. And next, again, another representation of our 7-day rolling average. You've now seen this 3 times, but this just shows you where we get concerned when we get into that 40 of 7-day rolling average. And as you've heard me mention, we're at 42 right now. We have seen declining admissions for the last 2 days, and we're hopeful that that will continue. And if that does continue, then that average will start to come down as well. But right now, today, we're still in that concerned area. The next is our prevalence of reported cases. And so this is an addition. We take the last 14 days, we add them together because that's a viral replication cycle, and we see how that compares to the population. And as you can see, we're still in the red area there. And that's really a result of all of those cases that we've seen accumulate over the last 2 weeks. And so we still have a significant amount of cases that are still out in the community. And next is our weekly change. So this is where you'll start to see that number fluctuate a little bit. And so it's a rolling 14-day average, and then we compare it to the previous rolling 14 days. And as you can see, that percentage is starting to come down, which is good. So the case counts are starting to come down. The rolling average percentage will start to come down. But we're still in that danger zone, and that's mostly because we still have a large number of cases circulating out in the community. Our testing positive rate, so you've heard us talk about that before. We want to be below 10%, and actually we probably want to be even farther below that than 10%. We believe we're around 11.2 right now, which means we still, again, have a high number of virus circulating out in the community. And then our transmission, our reproductive number, which we're sitting at like around 1.26 right now, which is down. Again, as you can see, it's starting to trail down, which is good news. But we want it to be below 1, and that's how we know when we've interrupted transmission. Okay, so I've just shown you a lot of data, and I know it can sometimes be confusing, but the biggest takeaway from all of this is that although we've seen some, glimmers of hope, we still have a large amount of virus circulating in the community, and that won't go away overnight. It takes time and it takes effort to get those numbers to come down. The rolling average of patients being admitted to our hospitals is still concerning. I've just showed you all of our scorecard data, which the majority of it is still concerning. And although the numbers don't feel overwhelming as far as our hospital capacity and our ICU capacity, the point is you never want to get to that spot. Whenever we see those cases and those admissions rising at a rapid rate, we need to pump on the brakes and realize that we need to take action now, because you don't want to get to the point where you're being overwhelmed. By then it's too late. So we know that there's a significant number of positive cases still out in the community, and we also know that there's asymptomatic spreaders out in the community, which means we'll continue to see hospitalizations. But if we want to see those cases come down, we have to interrupt transmission. And really, if we get the majority of people in the metropolitan area, regardless of if it's mandated or not, to wear a mask. If not, we're going to continue to see sort of this ebb and flow and these peaks and valleys in cases because that's how it works. Transmission will continue throughout the community if everybody isn't adhering to all of those really evidence-based, easy things to do, like mask wearing, social distancing, and not being in large crowds. So whatever, we'll continue to follow the cases, and we're hopeful that those numbers will continue to decrease, but it really takes everybody contributing if we want to continue to see all of those numbers headed in the right direction. And now I'll take some questions from the media.
What steps could be taken if the new restrictions in the St. Louis County don't reduce the spread?
Well, that's a difficult question to answer. I think what we need to do before we get to that is to take a good look at the data to show what is the impact of the masking policy, especially in St. Louis City and St. Louis County, as well as some of the new restrictions. We know it takes time to see what the impact is from some of those actions. And then we also have to get data back from our public health partners to understand where is transmission occurring. Is it occurring at restaurants and bars and places like that? Is it occurring in other places? So you can take more targeted action more so than widespread action. The last thing we want to get to is to that place where we have to shut everything down. And I'm hopeful that we won't. And some of the data coming in, it looks promising. But again, it takes everybody participating. But I think I'd rather wait, take a look at the data, see which direction we're headed before we have those conversations.
With tomorrow marking Election Day, what advice would you give to people going to vote or running to polling places?
Well, first of all, my recommendation is to vote. But secondly, if you need to go to a polling place, then practice all of those things that we've been discussing here. So the social distancing, so 6 feet, wearing a mask. All the polling places that I know of are indoors, and so you need to bring a mask with you, regardless of if you're in a mandated area or not. It's just common sense to wear a mask indoors. From what I understand, the polling places will have hand gel and things like that, and we'll be cleaning if you have to use a stylus or a pen or something like that. And so all of really those common sense things will absolutely decrease your risk of contracting COVID. So just follow all of those really simple rules that we've been talking about here for some time.
You have said it's going to take a little while to see the effects of the mask wearing policies on cases, hospitalizations, and so forth. Now that it's been close to 1 month since the mask mandates went into play here in St. Louis, are we starting to see any tangible evidence that they're keeping people from getting sick?
Yeah, that's a good question. It's a challenging question to answer, and one of the reasons for that is that we don't have a universal masking mandate across our region, and we know that there is an increase in compliance when you do have the mandated masking rules, and we also know that we have a highly fluid population, so people come and go from those different areas, and so trying to tease out what the effect is because of all that can remain challenging. But nonetheless, from the data that I showed today, we have seen a slight turn in the number of cases in the reproductive factor and in our hospitalization data, even though it's just a couple of days, so I don't want to over promise anything. But I'm hopeful that that's the start of a trend. And we'll continue to follow the data and see if it keeps pushing those numbers down. But to the questioner's point, I think it still remains to be said that if we can get the majority of people to wear masks, then we will continue to see the benefit. The evidence supports that without a doubt, that masking is one of the best ways that you can get transmission down.
These next two questions are related to large crowds and gatherings. Would the Pandemic Task Force mandate people to quarantine if anyone went to a large gathering?
Well, we can't mandate anything. That's for the public health officials to do. However, we would recommend that if people are putting themselves in high-risk situations, that it would be prudent to do things like quarantining themselves, especially if you're in large crowds where there's no social distancing, where people aren't wearing masks, things like that. And again, it's not necessarily, especially if it's the younger population that are in crowds and things like that, we know that younger people aren't as affected by COVID, but it keeps spread occurring in the community. And so we're not, we worry about people that's going to be spread to, the more vulnerable population that will end up in our hospitals. And so, first of all, it's important not to put yourself in that position, but if you are in that position, it's prudent to quarantine yourself.
Have you seen any additional data in cases when it comes to large gatherings, such as those parties and concerts in the Lake of the Ozarks, or those seen this weekend from the Pike County Fair?
Well, I did see some articles about large gatherings down at the lake and the Pike County Fair and things like that. Again, it takes time for those cases to show up. So I'll just go back to reiterating my points, which is large gatherings without masks and no social distancing are breeding grounds for spreading the virus. And so we should be doing everything that we can to decrease that risk of spread. It may not affect the younger population as much as other populations, but again, it's not so much that we don't worry about them, we do, but it's the people that you're going to transmit it to that we worry about as well, particularly people that are more vulnerable, immunocompromised, elderly people, people with chronic medical conditions. Those are the people that are going to be affected. And so, I would just ask people to avoid putting yourself in those risky situations, and because it's not helping the community, it's not helping us recover from this pandemic.
The city of St. Louis is still allowing large venues to operate at 75% capacity. There are no rules for when bars must close. There are no limits in the size of gatherings. According to the task force, the moving average of new hospital admissions is well into the red zone, and the region is still on track to hit a second peak at or around August 27th. Has Mayor Lyda Cruzan and Public Health Director Dr. Fred Eccles remained in communication with you about these dangerous projections? And are these leaders well informed about all the projections that you provide to the public?
Well, we share our data with all of the elected officials in the public health department, so they get the same data that we have. We do discuss our projections and what we're seeing as far as hospital admissions and hospital occupancy and all of the other data that we share with all of the elected officials. So the mayor and Dr. Eccles have seen the data as well. They believe in this targeted approach with focusing on venues that aren't practicing social distancing or mask wearing and things like that to see if they can get the transmission under control that way. And that, is different than the county, and we recognize that. But they've been looking at the data just as much as we have, and so they believe that they can get transmission down by taking this more targeted approach, and we're hopeful that they'll be correct with this. And we'll continue to follow the data and see what impact that has on transmission as well.
That concludes our list of questions from members of the media. Thank you for watching.